Good morning. Today we are going to deal on most important topic, so that is Cushing syndrome. So now what is Cushing syndrome? So what it means? What is the definition for the Cushing syndrome? What are the causes and risk factor for the Cushing syndrome? So what happens in the Cushing syndrome? So that is pathophysiology. What are the signs and symptoms we are going to see in case of Cushing syndrome, and complications for the Cushing syndrome, and how we are going to manage the Cushing syndrome. Let's see one by one detail. So now come to the first introduction. The Cushing syndrome also we call as hypercortisolism. Because there is excessive secretion of, so that is cortisol. For that reason it's called as so hypercortisolism. It is first time described by the William Harvey Cushing's in the year of 1932. For that reason, name given as the Cushing's syndrome. He is an American neurosurgeon. The first time identified the case. For that reason, the name given as a Cushing syndrome. So usually the 2 to 3 people per millions they are getting Cushing syndrome in India or in the world. So the incidence of Cushing syndrome is 2 to 3 people we are getting per million per year. What is the meaning of this Cushing syndrome? What it means? According to the meaning of the Cushing syndrome, it means that is hyper secretion of cortisol is called as a hypercortisolism or a Cushing syndrome. From the definition of Cushing syndrome, the Cushing syndrome is defined as it is an endocrine disorder caused by the excessive secretion of cortisol from the adrenal gland, the resulting from that is pituitary tumor or else the adrenal tumor, characterized by the moon face shape, the papilla hump, hypertension, hyperglycemia, and pot belly appearance of abdomen is called as a Cushing syndrome. Now come to the causes and risk factors. Causes and risk factors. Causes and risk factors. So the most important causes for the Cushing syndrome is pituitary tumors and adrenal tumors. Pituitary tumors and adrenal tumors. The most important cause for this, that is Cushing syndrome. It means in case of pituitary tumors and adrenal tumors, there is an excessive secretion of cortisol from the adrenal cortex takes place. It may lead to the syndrome called as Cushing syndrome. Now come to the risk factors. So the smoking, alcoholism, tobacco chewing, the sedentary lifestyle, physical inactivity. Okay, so these are and also genetic. These are the important risk factor for the Cushing syndrome. Now come to the pathophysiology. The patho is nothing but disease physiology means. So what happens in case of Cushing syndrome? In a body, what happens? What are the cellular changes takes place inside the body in case of Cushing syndrome? So that is we'll see in the pathophysiology. What happens due to these etiological factors? So due to the causes, what happens? So that is either it may be pituitary tumor or the adrenal tumors. It may causes excessive secretion of ACTH from the pituitary gland. It secretes more ACTH and also it adverse effect on the adrenal glands and the cortex region. It stimulates so that is zone of vesiculata. So the layer it produces too much amount of ACTH. It adversely affect on the production of cortisol. See what happens in case of the pituitary tumors or adrenal tumor. What happens? So there is excessive secretion of that is cortisol takes place and the stimulation of ACTH hormone from the pituitary gland. What happens? There is excessive secretion of the cortisol is there. It may lead to the moon shape appearance of the face. So the papilla hump. So that is part. So that is you can take. So papilla hump is the excessive secretion of fat deposition in the neck. So that is we call as that is papilla hump. Moon face appearance of moon shape appearance of a face, and pot belly appearance abdomen pendulous abdomen, or a pot belly appearance of the stomach. Okay, so based on the signs and symptoms, it is diagnosed as a Cushing syndrome. In a pathophysiology, very simple. So what happens due to pituitary tumors or adrenal tumors? So in the case of pituitary tumors, what happens? There is excessive amount of secretion of ACTs takes place and adverse effect upon the effect on this. There is adrenal glands. Adrenal glands, the cortex region, so it produces more cortisol. The cortisol adverse effect on the so that is body. It may lead to symptoms like so that is more safe appearance of a face. So the excessive deposition of fat in the neck and the abdominal pendulous or a pendulous partially appearance of a stomach and also hypertension, hyperglycemia, hyperlipidemia. Okay, all this is see all the signs and symptoms we will see in the so based on the signs and symptoms it is diagnosed as a Cushing syndrome. Cushing syndrome. So now completing, so what are the clinical manifestations we are going to see in case of Cushing syndrome? So there is mood face shape, the papilla hump, and the pot belly appearance of the abdomen, and the osteoporosis, the menstrual irregularity, for example, amenorrhea, that is cessation of, so that is menstruation in case of in females. The one more, the most important feature is that so the science is that hirsutism means excessive growth of hairs on the body is called as hirsutism, especially in case of that is humans we are going to see now. So that is there is excessive growth of mustache and the beards. It is the most important sign for the Cushing syndrome. Okay, so these are the signs and symptoms or clinical manifestations of Cushing syndrome. Now come to the how we are going to diagnose so the Cushing syndrome. The physical examination and history taking is very important because the based on signs and symptoms, that is the physical appearance only, we will diagnose the person having or suffering from a Cushing syndrome. And then because the 24-hour urine cortisol test, and that is some dozens of present test, CT scan, MRI for diagnosing or detecting, so that is adrenal tumor or so pituitary tumor. Okay, so these are the important, so that is diagnostic measures are there to identify or to diagnose, and so that is Cushing syndrome. Now coming to the, so what are the complications? So the resulting from Cushing syndrome, what happens? The excessive secretion of, so that is cortisol is there, so what happens? So that is pot belly appearance. Pot belly appearance it may lead to the risk. And so the diabetic and the hypertension will lead to stroke, and diabetic may lead to diabetic coma and even death also. Question now come to this. So treatment modalities for treatment, the treatment options for that is management of so this Cushing syndrome. So management of Cushing syndrome it involves medical management, surgical management, and then nursing management. In the medical management, it is a syndrome. They have not having a specific syndrome means it is not having a specific cause, and also we are not having a specific treatment options to treat so the Cushing syndrome. We are treat so according to the symptomatically. Okay, so symptoms always we are treating symptomatically based on the symptoms we are going to treat. If there is a nausea or vomiting, we are going to administer the antiemetic drugs like aldosterone or NSAID. We are having a fever, so the antipyretics, for example, paracetamol, as prescribed by the doctors. And we are having this, so there is pain, the analgesic, and also the hyperglycemia is more common. It is very, that is high alert the medical conditions we are going to treat the the glycemic drugs. There is insulin management is very important. There is hypertension is there, the antihypertensive drugs are very important. Okay, so the treatment usually depends upon the symptoms. Symptomatically there is a option is only for how to treat symptomatically. Now come to the, so one more, so that is drug is that the ketoconazole. Ketoconazole is it is antifungal drugs. So some of the assumptions are there. The fact is there. The ketoconazole is having the capacity to inhibit the secretion of cortisol for that reason. So in the Cushing syndrome, so that is commonly used drugs. That is ketoconazole. Now coming to the surgical options, here the surgical options are there, here the tumors are there, the pituitary tumors and the adrenal tumors. So there is transsphenoidal through the nose, transsphenoidal resection of, so there is pituitary tumors or transsphenoidal hypophyseectomy, that is surgical removal of the pituitary gland through the nostrils is called as transsphenoidal hypophyseectomy. That is a one option. So if the suppose if the adrenal tumors are there, that is bilateral or unilateral, so the adrenalectomy is the option for so the treating as Cushing syndrome. Now coming to the nursing management. So the role of nursing officers is very important for treating a patient because it is a syndrome. It is not having a one signs, or it is one group of signs and symptoms. You are going to treat accordingly. Administer the drugs as prescribed by the doctor. The maintain hydration status, especially so that is fluid and electrolyte balance is very important. Well, because the persons who are suffering from Cushing syndrome, so there is a hypokalemia is there. The treatment of this, so the calcium level is very important because in case of Cushing syndrome, the hypocalcium is there automatically. The definitely it having a cardiac, it causes the cardiac problems. The based on the ECG changes, the hypokalemia signs. In case of hypokalemia, so there is a changes will be there in the ECG. Identify the ECG, based on the ECG, we are going to treat the symptoms. And also the health education for the patient who are suffering from the Cushing syndrome is very important. The provide health education to the patient and family members regarding to them. So the diet and the personal hygiene, so and medications and the physical activity within his own limit, and also the regular follow-up. Advise the patient and family members to seek immediately the any discomfort is felt. It's very important. So because it is a so that is syndrome for that reason. Okay, so this is about the what the regarding to the Cushing syndrome. Thank you.